I'm Chris Stout, a vascular and endovascular surgeon with Ozark Regional Vein and Artery Center, and today we're going to discuss vascular diseases specific to women. Women are quite different than men when you consider women's health and vascular disease in the pelvic region and in the reproductive realm. Women also have smaller arteries than men do in general of their arteries in their lower legs and arms and necks. Although the disease process of peripheral artery disease is the same in women, the smaller blood vessels can lead to more symptoms sooner. Generally, I see women get more blockages up in the aorta and iliac segments, so the most proximal segment. So these are the arteries starting at the belly button and going down through the pelvis leading to the legs. That's really good because these can be fixed and have long-term durability. The women's side of vascular disease, and we're not going to talk about peripheral artery disease here, we're going to talk about diseases that are specific to women only. And there's two of them that come to mind. One of them is going to be pelvic congestion syndrome and basically varicose veins in the pelvis. You see this around their menstrual cycle, their menses. Every month they are going to notice that they have more bloating. They may have pain around the coccygeal region or lower back, lower pelvis. They may notice large veins in their groin, veins around the vulva. They may see excessive vaginal bleeding, pain with intercourse, and generally you're going to find that they have these symptoms after they've had a few kids and things are dilated up and they've had that excess blood supply to the pelvis, which is needed for a baby. But once the baby's delivered, they don't need that anymore. But the veins don't always shrink down. Additionally, we're going to talk about uterine fibroids, which can also cause bleeding and pain and fullness and pelvic pain in these women. And in the past, there's been, treatments always involved surgery for these, but now we're able to fix these with minimally invasive techniques. It's a muscular growth in the uterus, and these can be anywhere from, a centimeter or half an inch in size all the way up to 5, 6, 7, 8 inches and larger. You can have multiple of them, and there's all types of configurations they can have in the pelvis and the uterus. The symptoms are going to be very similar. It may be pain in the pelvis, but generally you're going to see patients have really heavy menstrual cycles. They may have a lot of clots. Their menstrual cycles may be longer than normal. The larger uterine fibroids can compress structures in the pelvis, leading to different types of nerve pains and fullness, and it can affect the bladder, it can affect the rectum, it can affect all these structures to where, control of your urine is not there, pain with going to the bathroom is there, and all these other symptoms. If you have any further questions, you can head over to our website. We have a screening quiz you can fill out, and that will help us determine if you're a good candidate.